Hello, students. Good morning. Today we will deal with low birth weight babies and the factors leading to low birth weight and its prevention. So, the contents what we are going to discuss today are the introduction to low birth weight, the problem statement, causes of low birth weight, care of the low birth weight baby, KMC, that is kangaroo maternal care, and prevention of the low birth weight. So what is birth weight? The birth weight is the weight which is taken within 1 hour after the birth of the baby. That is the first weight. Is taken into consideration as a birth weight. What is the importance? The most important, it is the most important determinant of the survival, growth, and development. So the birth weight is more important. That's why everybody notes the birth weight at the time of birth. And it reflects the status of the mother, not only during pregnancy, but much earlier to that during the period of adolescence. How the girl child is brought up and the care taken during pregnancy through antenatal care and all. The low birth weight, that is the birth weight. Now the low birth weight is that infant with a birth weight of less than 2.5 kgs, which is taken 1 hour of the birth regardless of the gestational age. It is again graded as low birth weight, very low birth weight, extremely low birth weight. Low birth weight when it is between 2500 grams to 2000 grams. Very low birth weight means 2000 grams to 1000 grams. Extremely low birth weight if the baby is less than 1000 grams, where the survival is very difficult. So intrauterine growth, we can divide it as preterm, term, and postterm. Preterm is the period from the gestation, from the conception to 37 weeks of gestation period. From 37 weeks to 42 weeks, it is the term. And 42 weeks onwards, it is the postterm. The types of low birth weight, there are two types of the low birth weight. One is preterm, that is when the baby is born before 37 completed weeks of gestation. They account for 1/3 of all low birth weight babies. And another group is small for date, that is intrauterine growth retardation, and they account for 2/3 of the low birth weight neonates. Small for date means they weigh less than 10th percentile of gestational age. So classification of low birth weight is divided into two parts based on the maturity. Babies born prematurely, short gestation before completion of complete gestation period, and babies born with growth retardation. Based on the gestational age, so another group is there, which is again divided into preterm babies if they are born before the completion of 37 weeks of gestation, that is 259 days. Term babies are those who take birth between 37 weeks of gestation and less than 42 complete weeks of gestation. That is 259 days to 293 days. Postterm babies are those who are born after completion of 42 weeks of gestation. That is 294 days. So anyhow, the infant whose weight is 2.5 kgs or less than that at the birth, regardless of the gestational age, is called low birth weight baby. Again, the preterm babies who are born before 37 weeks of gestation are again subdivided into extremely preterm, means those who are born before 28 weeks of gestation, very preterm of those who are born between 28 to 38 weeks of gestation. Moderate to late preterm means those who are born between 30 to 37 weeks of gestation. They are born too early. The preterm babies are born too early, but their intrauterine growth is normal. They can catch up the normal growth and development with good neonatal care in 2 to 3 years. That means their growth is normal, but they are born little earlier, and they can pick up the growth and development within 2 to 3 years. You take a lot of care. Low birth weight in developing world is largely due to maternal malnutrition rather than the genetic origin. In developing countries like ours, genetic factors play a little role rather than the maternal malnutrition and infections. Now, what is the magnitude of the problem? Why we are discussing about the low birth weight? So, low birth weight is of grave consequences, and its magnitude is also to the extent of 15.5% of all global births. That means about 20 million infants worldwide are born with the low birth weight, that is less than 2.5 kgs at birth. Coming to Indian scenario, it is 33% each year. Whatever the low birth cases are occurring in a year, 33% will be of the low birth weight. And why we are bothered very much is that prematurity is the number one cause of deaths in the neonates and the second leading cause of death is pneumonia. First is prematurity, is the leading cause. The second leading cause is pneumonia. That's why I will discuss about the prematurity. The causes of low birth weight are divided into two groups. One is premature babies, less than 37 weeks, and second is intrauterine growth retardation. There is no proper growth inside the womb of the mother. So, this low birth weight, 50% of the cases, the cause is not known. In 50% of the cases, the cause is attributed to medical causes and social causes. Now, coming to the medical causes, what are the medical causes? The medical causes in the mother are high-risk mothers except diabetes, and placental causes, placenta previa, and congenital defects of the placenta. Now, the fetus is the important component, that is multiple gestations, hydramnios, intrauterine infections. If intrauterine infections occur, there will be growth retardation, multiple gestations, so multiple babies will be there inside the womb. That's why the growth will be compromised. And hydramnios, lot of fluid will be there, so the growth For the growth, there is no space for the fetus. But these are the medical causes. And social causes like poverty, illiteracy, ignorance, they depend on each other. The poor standard of living, lack of knowledge on the family planning, not giving birth spacing and all, early marriages before the girl is properly matured, the marriages are done, the growth of the baby inside the womb is also retarded. Smoking causes vasoconstriction, and the growth of the baby and supply of the blood to the baby is impeded. Now, the spontaneous preterm births, these low birth weights, the low birth weight babies, sometimes they are spontaneously delivered, of which there are some risk factors like non-communicable diseases in the preterm babies, early pregnancy, adolescent pregnancy like that, the late pregnancies, elderly mother, short spacing between the pregnancies, multiple pregnancies, twins, higher order pregnancy, some of the causes of spontaneous preterm births. Infections like urinary tract infection, malaria, HIV infection, syphilis, bacterial vaginitis, these infections will also lead to preterm births. The comorbid conditions like diabetes mellitus, hypertension, anemia, asthma, thyroid disorders, obesity, undernutrition will also cause preterm births. Micronutrient deficiencies is another cause. Lifestyle modifications, lifestyles like smokers, alcoholics, drug abusers, excessive, those who undertake excessive physical activity, they deliver much earlier called preterm deliveries. Psychological illness in the mother like depression, violence on the women. Suppose the husband beats the wife and she may go for premature birth. Genetic factors, cervical incompetence. Sometimes genetically the cervix will be incompetent. That means cervical dilatation will be there from the very beginning so that it cannot hold the product of the concept for a much longer period up to term. So prematurely they deliver. So sometimes the preterm birth may be induced. That is called provider initiated preterm birth. That is medical termination of pregnancy, cesarean section due to some obstetric indications or fetal indications. Sometimes there may not be medical indication, or maybe social indication. Sometimes the risk factors for both types of preterm births overlap. The risk pattern births demand increased attention to maternal health, that is in the form of antenatal care, antenatal diagnosis of the conditions, and management of the non-communicable diseases. So these preterm births indicate that we have to take more maternal care. The preterm babies are at greater risk of non-communicable diseases like hypertension and diabetes. Small for dead babies is another term where the babies born at term or preterm, they may take birth at term, complete term, that is 37 to 40 weeks, or preterm before 37 weeks of gestation, but they weigh less than the 10th percentile of gestational age according to the is they don't give that much weight due to intra-uterine growth retardation. They are called small for date babies. Now the percentage of the low birth weight is calculated as number of live births with birth weight less than 2.5 kgs per 100 live births. That is the percentage of the low birth weight babies, for which small for date babies, the maternal factors are malnutrition, severe anemia, heavy physical work, hypertension, and infections like malaria, toxemia, smoking, low socioeconomic status, short stature, very young age, close spacing. These are all general causes in the mother which may lead to small for date babies. Small for date babies are at greater risk of dying in neonatal period. Neonatal period means within 1 month of the birth, the babies usually die. And they increase the infant mortality rate. If they survive more than 1 month, they may die within 1 year, and they may die during the perinatal period within 42 days of the delivery, perinatal period. So perinatal mortality is also increased. During infancy, if they survive for up to 1 year, small for date babies contribute for protein energy malnutrition and infections because of very complex mechanisms in the immunity and sustainable and this the fighting force against the infections is reduced, and they cannot assimilate food, or due to the factors, social factors like poverty and ignorance and all, the mothers, they don't feed properly, so they develop protein energy malnutrition. The importance of low birth weight. Why it is important? From the public health point of view, it is very important because it is a challenge to the maternal and child health services in all countries. Public health importance is the association of the low birth weight with the mental retardation increases the risk of perinatal mortality, infant mortality, and morbidity. Because of low birth weight, perinatal mortality, infant mortality will be increased, and there will be more lot of morbidity in the infantile stage. There is human waste and lot of suffering and high cost of the care. Low birth weight also indicates level of care needed for each baby. Each baby needs a special care, and also it indicates inadequate nutrition and ill health of the mother. The main reasons for this low birth weight is ill health of the mother, malnutrition of the mother, infection of the mother, and other risk factors. So they need to be taken care of. The second important public health importance is that the low birth weight determines the child survival chances. So how many years the child is going to survive, we can predict depending upon their birth weight. Many of them die during first year of their life. Before they complete 1 year, they die because infant mortality rate is 20 times greater for low birth weight babies as compared to the normal birth weight babies. A high incidence of low birth weight reflects deficient health status of women inadequate perinatal care, need to improve new birth care. Because of low birth weight, all these things we have to think of. Prevention of low birth weight babies. How to prevent the birth of the baby with low birth weight. There are multifactorial causes. Just now we have seen social causes, maternal causes, placental causes, fetal causes, social causes like poverty, illiteracy, and socio-economic status. All these factors, which is a multifactorial in nature. So there is no single solution. That's why we have to approach in a multi-pronged way. So in experts' opinion, not more than 10% of the low birth weight babies could be reduced in all parts of the world, because the risk factors and causative factors are so much so that we cannot control with a single weapon. That's why we cannot, they have got the opinion that we cannot reduce more than 10% low birth weight babies. Good prenatal care and interventional programs are better than treatment of the low birth weight after birth of the baby. It is better to have a good prenatal care and intervention programs before the birth of the baby, much before the birth of the baby. We have to prepare the girl child in the early childhood, during adolescence, during pregnancy, during antenatal period, during internatal care, and postnatal care. All these things we have to take care of rather than treating the baby who is already born with the low birth weight. It is because it is very costly affair. So there are certain interventions called direct interventions and indirect interventions. Direct intervention measures are early identification of the high-risk pregnancies through mother and child protection cards. For each registered antenatal case, they open mother and child protection card in which they record all the events the women undergo, so that they can identify who are at risk, and managing those cases will reduce the low birth weight. Treatment of the malnutrition and infections in pregnancies can reduce the low birth weight. For example, increasing the food intake with iron and folic acid tablets for anemia will definitely increase the birth weight of the baby. Supplementary feeding with the distribution of iron and folic acids, fortification and enrichment of the food with the required nutrients will also increase the birth weight. Controlling the infections. As the maternal infections may go unrecognized, sometimes the mother may not recognize, the health workers may not recognize. That's why they should be constantly under vigilance of the antenatal cases, and if they do early diagnosis and if they treat properly the common infections, the endemic infections in a particular area, the growth of the mother and the growth of the fetus will be proper. The infections like malaria, urinary tract infections, cytomegalovirus infection, toxoplasma gondii infection, rubella, syphilis, all these infections, if they are taken care and identified and treated properly, there won't be low birth weight babies. Treatment of the medical conditions or disorders. The maternal conditions like hypertension, diabetes, toxemia should be properly treated. Then only we can reduce the low birth weight babies. The indirect intervention measures, they are long lasting and the effect is also seen after a long time, but we have to take care of them, and proper health education should be provided regarding family planning, avoiding smoking, and improved sanitation. They don't use short-term results. They will have long-term results. And increase the health and nutrition of the young girls, along with improvement in the socio-economic and environmental conditions and health services in the underserved people or underserved areas are more effective and long lasting. There must be government support also in terms of maternal leave, provision of maternal leave with full wages, and certain child benefits should also be given in order to support the below poverty line people not to deliver low birth weight babies. Treatment of the low birth weight babies. If the baby is less than 2 kgs of weight, it requires first class modern neonatal care in intensive care unit till the weight reaches 2 to 2.5 kgs. If the baby's weight at birth is 2 to 2.5 kgs, they need intensive care for 1 or 2 days. Then you can discharge with some advices. There is a term called kangaroo mother care for low birth weight babies. As you know, kangaroos are the animals who carry the babies inside the pouch-like thing naturally provided in the abdomen. So that concept is taken here to protect the low birth weight babies. As the mother is kept on the chest of the baby is kept on the chest of the mother so that the temperature will be properly maintained, skin to skin contact will be there, proper bonding will be there, emotional bonding will be there, breastfeeding will be properly given. So these are the advantages: skin to skin positioning of the baby on the mother's chest, adequate nutrition through the breastfeeding is possible, ambulatory care as a result of early discharge from the hospital. So mother can take care of the baby if she is kept on the chest of the mother. Support for the mother and family in baby care. The mother should be supported to take care of the baby. So intensive care for low birth weight babies. It comprises of incubatory care, feeding, prevention of infection. Incubatory care means they are kept in the incubator where there will be adjustment of the temperature, humidity, and oxygen saturation. Feeding. Breastfeeding is rarely possible in the premature baby because they cannot suck the milk. So nozzle catheter is used to feed the baby. Prevention of infection. Infection is the greatest hazard in premature babies, particularly the respiratory infections may lead to death within few hours. So usually infections may lead to death out of pneumonia. The leading causes of death in low birth weight babies are atelectasis. The lungs will be hardened and malformations in the child is also the cause of death. Pulmonary bleeding in the lungs. Intracranial bleeding secondary to anemia may result maybe from anemia or during birth trauma. The birth trauma is the maximum during the childbirth to the fetus because already she is premature. The baby cannot sustain such a pressure and intracranially there will be bleeding. And pneumonia is one of the commonest infection and the leading cause of death in low birth weight. Newborn services like newborn care corner must be there in all tertiary care units, tertiary care hospitals. Newborn stabilization unit must be there. Spontaneous newborn care unit, etc. Improve management of the low birth weight babies. All these things will improve the management of the low birth weight babies if they are provided in a tertiary care hospital. Development of the perinatal intensive care units have been associated with the decline in neonatal mortality. So special care at hospital, prevention of infection in the form in terms of prophylactic antibiotics to prevent the septicemia, separate nurses for feeding, separate set of nurses to attend the toilet and all. Barrier nursing should be applied here to prevent the cross infection. Prevention of hypothermia. Hypothermia is one of the dangerous things which may lead to death of the baby. So the child is kept under an incubator which maintains the temperature and oxygen supply till the weight of the baby increases up to 2000 grams. Careful monitoring of the oxygen supply is a must. If the oxygen supply is low, the baby will undergo hypoxia and cerebral palsy. If the oxygen supply is more, the baby may develop retinopathy. Retrolental retinopathy may develop. Correction of the malnutrition. Already the baby is malnourished. Further malnutrition should be prevented by giving tube feeding, either tube, nasogastric tube, or to oral feeding. Breast milk should be extracted and should be fed to the baby with a spoon because baby cannot suck the mother's milk. But thank you. This finishes the low birth weight and its management. Thank you.